So bladder cancer is a cancer which arises from the lining of the urinary bladder, but which can extend it to involve the wall of the urinary bladder as well, and it can spread to the lymph nodes and to the other parts if it is in the later stages. So basically, the causes of bladder cancer are tobacco, smoking, chemical exposure, etc. So you can avoid smoking tobacco or chemical exposure to all this carcinogens, and mostly industrial exposure to chemicals also can be avoided to prevent the bladder cancer. So usually patients with bladder carcinoma presents with the most common symptom is blood in the urine. Usually microscopic hematuria, that means like which is not visible to our naked eyes, that is not very concerning. But when visible blood is there in the urine, that means something is wrong. So you should get yourself evaluated with a minimum cystoscopy and ultrasound of the abdomen and pelvis. So if blood is there in the urine, then it should either be coming from the urinary bladder or the urinary tract, like kidneys or the ureters. So best way to assess the site of bleed is to do a cystoscopy and ultrasound of the abdomen and pelvis. And based on the reports, we can subject you to higher tests like CT scan, PET scan, etc. So basically, bladder tumors can be like superficial bladder tumors and muscle invasive bladder tumor. Okay, so superficial meaning non-muscle invasive bladder carcinomas. Those are early cancers. Basically, that can be treated with a like minimal procedure like cystoscopy and transurethral resection of bladder tumor, that is called as TURBT. Okay, and then post that you may need some like intravesical therapies, like few cycles of that, and you are fine. But if it is a muscle invasive tumor, then treatment may be little complicated. Like you may need complete removal of your bladder, or if you're not willing for such extensive procedures, then there is an option of chemo RT, which is called as bladder preservation protocol, etc. So don't ignore any kind of blood in the urine. Okay, get yourself tested by an expert surgeon, surgical oncologist, or a neurologist.